Hey, Joshua Austin here, president of your San Antonio District Dental Society. And I was able to coax my good friend, Dr. Michael DiTolla, to spend a couple minutes with us today to give you a quick preview about his continuing education course that's coming up on September 16th, 2016 at Oak Hills Country Club. Thanks for spending a couple minutes, Mike. Appreciate it. How's the weather there in Charlotte?
It is hot and steamy, Josh, much like the reaction that you often get when you walk into a bar by yourself.
Absolutely. So tell me what's go ahead. What are dentists going to learn at this course on September 16th?
Well, they're going to learn. Hopefully, they're going to learn an easier way to prep crowns. You know, I struggled prepping crowns early in my career, and I had to find an easier way to be able to do it and to be able to get predictable results. You know, I practiced inside of a dental laboratory and the technicians there weren't shy about telling me what they didn't like about my preparations. And so I thought that I was the only one having, you know, a lot of these crown prep issues, and you've been there before, when you walk through the floor of the laboratory, preparations and impressions, you can see that most of us struggle with the same, you know, 4 or 5 issues. And just to, you know, for self-survival, because we were filming my dentistry, I had to come up with a way where I could get good results, above average preparations and impressions with a below average set of hands. So I want to share that preparation technique. If he doesn't adopt the whole thing, even if they take 1 or 2 little things from it, I think they can make their life a little easier for themselves to prep. And to me, that's what it all comes down to, is not getting phone calls from your laboratory. And if you can lower your remakes on your simple cases, like your 1-unit crowns that are adjacent with each other, life goes a lot easier, and the practice is a lot more profitable when you're not having to reappoint people for another appointment to re-anesthetize and take a new impression or reduce more on the prep.
So, you know, I go to a lot of C courses, and a lot of times it's very exotic, very comprehensive, you know, very specific based stuff that is taught in the CE course, which may or not be relevant to everyday practice depending on what your practice is like. It sounds to me like your course is much more designed for someone who learn this on Friday and go back on Monday and make some changes immediately based on, you know, very, you know, simple single unit kind of dentistry that most of us do all day long. Is that correct?
That's too big of a gap for me. I want you to learn it Friday and then go back to the office Friday evening and work on one of your assistants, your hygienist, and do it before you have a whole weekend to forget it. That's how quickly you need to implement these things. But, you know, we just had Frank Spear come and speak at Sarah World, you know, and he was talking about very complex cases, watching them over decades, or guys like John Coyce do a great job on full arch and full mouth rehabs. But most of the dentists I talk to aren't, you know, most of their days by doing these huge cases. I want to focus on the things that are going to fund your retirement plan, your vacations, and that is the 1 and 2 unit crowns, with the sweet spot being able to do, you know, 3 at a time. Those 14 unit, 20 unit cases are difficult. It's very easy to end up with a couple remakes and lose the profit on that. I like to focus on the simple things, because I know that's what dentists spend most of their time doing, are crowns in 1s and 2s.
Yeah, you know, I went to your course, this same basic course, a few months ago, and was able to take stuff away from it immediately. You say something in your lecture that I still don't believe to this day, but it's a big fundamental part of the lecture, is that you have average hands, and you claim that you are a remedial operative. I still don't believe it, man. I got to tell you, I've seen your preps. They're damn good.
Well, and that thank you, but that's only because of this technique that I'm going to share. You know, unfortunately, I was in dental school before, you know, we had smartphones, or I would have taken pictures of myself in remedial operative and tweeted them out, or I'd be able to send them to you today. But I remember one of my best friends, a guy by the name of Rob Cunin, who's an orthodontist now, and he could see I was having problems with my preps. And he came over, he slid down, he sat like 2 people away from me. He slid down and he looked at my prep and he goes, "Yeah, I see that that doesn't look great." And I had like earbuds in, And he goes, let me see those for a second. He put them in. And it was Midnight Oil. It was this really raucous Midnight Oil song. He goes, no wonder, you know, maybe we should switch you to classical music. But I was definitely in remedial operative. I almost showed my dental school transcript at Zero World this year, but it was going so well that I thought I'll save it for next year when I need material. But one of these days, I'm going to be the first speaker to put their dental school transcript up on the screen and let you see all the grades that led to me being in remedial operative. And when I ask groups all the time, I say, raise your hand if you were in remedial operative or remedial crown and bridge. I never really see many hands go up. Part of that's embarrassment, and part of that's because I really did struggle with my hands, and I wasn't very good. And I hope, and I think it kind of proves my claim that quality impressions are really just a choice in dentistry. I used to cut myself a lot of slack because I didn't have great hands. To be like that, there is a way to get the same preps as the preps of the masters. You may have to slow down a little bit, cuts in the right place and connect them all. It ends up looking just like a textbook prep, any kind of artistic prep by numbers, kind of like paint by numbers. And I used to feel embarrassed that I had to prep teeth that way to get a good result, but today I don't care. I'm all about the end result. I'm all about the patient getting a nice looking, properly reduced crown that's going to last for decades, not years.
Well, thank you very much. You know, I mean, it would be great if the SADDS was rolling in cash enough to bring in Frank Spear, John Coyce to come and talk. But even if we could, you know, I think a much better service to the dentists of San Antonio is to talk about fundamental things that they can do right away in their practice to make them better and more profitable. And I think this is it. So dentists of San Antonio, we will see you on September 16th. Be prepared to learn, be prepared to laugh, because not to put the pressure on Mike, but he kills it at the microphone. So thanks for spending a few minutes with us. I appreciate it. I'm looking forward to seeing you on the 16th and hopefully having a really good time.
It'll be great. Look forward to meeting everybody on the 16th. Thanks, Josh.
Thanks, man. Peace.